There's a lot of questions that go through our minds as veterans when we think about reaching out and taking those steps. The questions are understandable, reasonable, and really hard to answer completely in the moment. But if we could all focus on just taking one step, what's one step that you're willing to take now, and then go from there?
Suicide has been on the rise in recent years. Between 2000 and 2021, suicide rates increased approximately 36%, and over 48,000 people died by suicide in 2021 alone. It's a national public health issue that impacts people of all walks of life across our country, and our veterans are at higher risk. While those stats sound quite alarming, the suicide rate for veterans is actually 57% higher than those who haven't served. That's more than 1.5 times the national average. I know that sounds really bleak, but suicide is preventable. And for the U.S. Department of Veterans Affairs, or VA, preventing veteran suicide is a top health priority. This is Empathy Affect, Forest Marsh Media's podcast that explores the human side of government. I'm Melissa Harris, and since September is National Suicide Prevention Awareness Month, we're devoting this episode to learn how the VA is supporting programs to lower our veterans' suicide rate. With us today is the Director of National Suicide Prevention at the VA, Dr. Matthew Miller. During our discussion, we'll explore why veterans are at higher risk for suicide, the VA's resources on suicide prevention and mental health promotion, and how the VA is providing ongoing support for veterans, their caregivers, and their families. Dr. Miller, welcome to Empathy Affect. It's an honor to have you on the show in honor of Suicide Prevention Awareness Month.
It's great to be here. Really appreciate the opportunity.
Yeah. So while suicide is a major issue across the country, rates among veterans are higher than non-veteran U.S. adults, which is quite alarming. What are the risk factors and what makes veterans at higher risk?
Well, let me start by saying why I'm sitting in this seat and how I got here in the first place. I'm here because as a military Air Force psychologist, I experienced the death of a friend and a colleague, a Marine pilot, by suicide. And I was the chief of mental health at the installation where we served. That led to a lot of why related questions. And I think one of the difficult things I've had to learn when asking why and why veterans is the truthful answer, which is there's not one reason, and it's not an easy or simple explanation. There are a number of complex factors that interact, and it boils down to, in many ways, taking a look at risk factors, protective factors, minimizing risk factors, maximizing protective factors. Now, with that, veterans bring a lot of protective factors to the table. They bring a lot in their training, in their background that we know help to protect against suicide. But yes, as you mentioned, there are risk factors inherent as well. We focus within VA suicide prevention on maximizing and equipping veterans to leverage their protective factors and face head on with resources their risk factors.
Yeah, that's really true. And that also makes me think about mental illnesses and substance use disorder. Although it's not always linked, most research shows that these kinds of conditions often co-occur with suicide or risk for suicide. So how do you see these affect or amplify risk of suicide among veterans?
Well, we know that mental health fits as both a risk factor and a protective factor, especially with veterans. We know, for example, post traumatic stress disorder. That can be an elevated risk factor for suicide behaviors like thoughts and attempts, as well as death. But we also know that veterans who have engaged in care, evidence based care for PTSD, we've seen close to a 30% decrease over the last 20 years in their suicide rate through VA care. So while we know there are risks there, we know that we can bolster the protective aspect of that through engaging in evidence based care.
Yeah. And you've been in the field of military and veteran mental health and suicide prevention for the greater part of your career. Across this time, even amid what you've just shared, what have you seen to be some of the greatest challenges in preventing suicide among veterans or even service members, if you can speak to that?
I think one of the challenges that we're trying to meet head on right now is it can be reflected in this conversation. There's a significant and meaningful aspect of suicide prevention that is what we would call clinically related, like mental health care, like medical care. And a lot of that is individually based, treating and working with an individual veteran. But what we're learning and seeing is that suicide prevention needs to go way beyond the individual and the mental health clinical care and extend into other meaningful areas of life that can serve as risk or protective factors: financial well being and health, occupational development and stability, relational health and development, what's occurring in the community that the veteran lives within, and how enriching and protecting is the community that they reside in.
Mm.
So I think one difficult aspect has been for a healthcare system like the VA to move beyond healthcare and into these other areas of suicide prevention that are so important. I think we've made some headway there. We have the governor's challenge, for example, where all 50 states are participating, plus 5 U.S. territories, and they're sending teams for us to train and work with, who are then going into their state under the heading of the governor and working on state specific, locally driven veteran suicide prevention plans in communities.
Yeah, that's really great. And I really hear you there when it comes to that. It's a holistic approach, not just the
Yes.
health.
Yep.
I've heard so many stories of many veterans struggling with transitioning back to civilian life. You're sort of touching on finances, finding purpose or a career, coping with trauma, housing instability. So, how are you working to address these different aspects of veterans' well-beings? And are partner agencies like the Department of Labor, Housing and Urban Development, or HHS, any others working with you to address this?
So I'm going to make a link there that you might not expect or automatically see. Why is he making this link in light of that question? But I'll try to do it here. So what are we doing about these sorts of things? My mind, when you said that, went to thinking about firearms and safety. And the reason my mind went to that is we know that 70% of veteran suicides are by firearm. We also know that the time between the thought of suicide and the action taken can be 75% of the time, less than 60 minutes, less than an hour. Now, when the action involves a firearm, 90% of the time it results in death.
Mm.
So we know that if in those 60-minute windows of time, we can introduce the concept of creating space between a veteran, a firearm, and ammunition, that'll be life saving. That'll be absolutely life saving. Now, why do I mention that focus? Because we find that a lot of veterans who die by suicide secondary to firearms, it's not the one that we're it's not the ones that we're flagging as high risk for medical or mental health reasons. It's actually the ones who are experiencing what seems like a big financial problem, what seems like a big relationship problem, what seems like a big job problem, and they have ready access to a firearm, 60-minute window. So one, that's why it's so important in that context, in those situations. Yeah, we need to address financial resources more broadly, occupational development and matching more broadly. But in those moments, we also need to be addressing, introducing and increasing time and space between firearm and the veteran.
Yeah, 70% is shocking
Yes,
percentage.
yes, it's much higher than the non-veteran rate. Non-veteran overall U.S. population when it comes to suicide, a little less than 50% are firearm. Move it to the veteran population, 70% firearm.
Wow. Is there a reason why firearms are such a bigger factor for veterans?
I think proportionally, compared to the general population, more veterans own a firearm. I think that due to background and training, more veterans are familiar with and have used a firearm. And you put access through ownership and knowledge through practice and history. And that combines to a much higher likelihood of using the firearm towards oneself in those critical time periods.
Hmm. Yeah, that's a great point. Can you share with our listeners, especially those who have been impacted by or who are at risk for suicide, what the VA is doing to reduce suicide rates and support mental health and recovery for veterans? You just mentioned how that critical period when someone is really considering suicide is a moment to step in. So, maybe it's the launch of 988 and how people can just go to the Veterans Crisis Line by pressing one. What things have you seen being most impactful, especially since you've spent 20 plus years in this field?
Yeah. I'm glad you mentioned 988 and Press One. I think that that's an important development that's occurred in the last year, 2 years. We've seen about close to a 15% increase in veterans reaching out to us by phone. We've seen almost a 50% increase in veterans reaching out to us by text since 988 Press One started. So obviously, we're meeting a need there with the development and implementation of 988. And that's nothing but a good thing that veterans feel that it's more readily accessible and are using it more frequently. I think the other thing we're doing is reflected within upcoming Suicide Prevention Month, where we're really emphasizing with veterans something that in many ways is counterintuitive to veterans, and that's take a moment to think about yourself and take care of yourself. The theme with Suicide Prevention Month is reaching out in an effort to get help when help is needed. And oh, by the way, we all have times where we need help. We all have times where suicide is actually a risk. And so reaching out during those times is really important. And so the campaign focuses on using veterans and their words and message to share with other veterans. Yeah, maybe we should take a moment to reach out for ourselves as well. You can go to va.gov/reach to find out more about our materials and about Suicide Prevention Month.
Yeah, that's really fantastic. And I love the advice to take a moment to think about yourself. I feel like veterans throughout their careers in service. It's all about serving others, serving this nation. Self care is also really important. Part of self care, too, is overcoming stigma around what's going on in your head, substance use disorder, mental health. It's still a big barrier in seeking help and getting to that point of self care. So, how do you see stigma impacting risk for suicide and any co occurring SUD and mental health issues? And how is the VA working to address stigma in its messaging?
Well, I think one way we're working to address stigma is we're getting the word out that we're willing to talk about this. We're willing to talk about firearms. You see that in our Keep It Secure campaign and suicide prevention. We're willing to talk about the word suicide and reaching out for help. You'll see that this fall in a partnership we've developed with Metallica. Metallica has a song, Screaming Suicide, where the point of the song is talk about it, don't keep it inside. And we'll be promoting that message by saying, hey, let's talk. It's a good thing to get it out there and talk about it. So I think that's one thing that we're doing as well to help with stigma. One thing that I think I've learned about veterans when it comes to stigma, though, is everything I said is good. It's important to do. But if a veteran knows that something is the right thing to do, it's going to be effective, and it's easy to access it, like minimal inconveniences, minimal drag, as we would say in the Air Force, a veteran is going to do it. And so the other aspect that we really need to continue to challenge ourselves on in the VA is continuing to get the word out about how treatment and resources can help. They are effective, and lowering and decreasing barriers to getting to that help at local facilities or in the community.
Mm. Yeah, I love that. And, once you can get over stigma, you can pursue treatment, recovery. How can veterans with co occurring mental health and SUD build resilience and work toward maintaining recovery once they're on that path?
And I think the process of engaging in care and treatment, where you have a recovery oriented, veteran centric plan that's driven by the veteran on maintaining and sustaining recovery and recovery mindset and approaches is important. The recovery mindset is one thing that I really appreciate about VA mental health and its approach. It views it as a journey. It views it as a process, and it also, as part of that, views it as sometimes it's two steps forward, one step back. Sometimes it's one step forward, two steps back. So, what resources and support can we provide along the way and along the times of the journey when it's one forward, two back, or two forward, one back?
Mm. Yeah, that's a great point. As we've been talking today, I kind of want to ask about your personal connection to suicide prevention. You've dedicated so much of your career to this and to mental health. So, amid the work you've done with the military and veterans and suicide prevention and mental health, what personal connection is there that drives you to do this work in this space?
I think it started with the death of my friend and colleague, and I that was it's I mean it's difficult to convey in this context the impact of that. I think I felt that I was given the assignment as chief of mental health at this particular joint services installation during OEF OIF, and with a sense of trust from my commanders and leaders. And I really felt like I let down so many levels with John's suicide. And then the journey then that I went through was an eye opener in terms of what we know and don't know about suicide and suicide prevention and what people go through. And that really then propelled me into wanting to dedicate more time into this, but not initially. I actually spent a period of time running away from it as far as I could. I mean, heck, for a couple of years after the military, I sold shoes. As far as I could get from this, I wanted to be. But I think Providence and life brought me back to a point where it was time to face it head on and address it head on. Since then, I've been working in this, and I've learned along the way the importance of maintaining objectivity and not over personalizing, but yet also bringing that personal history and component into it. And most days at the end of the day, I'm pretty tired walking that fine line.
Oh, yeah, I feel you. A, self preservation is important. So, got to respect that. But B, those personal connections matter. Candidly, my brother's childhood best friend committed suicide a couple years ago. He wasn't a veteran, but, was a college student. And he was like a little brother to me. So that shook me. So it compels us to support people and to, think about it, find solutions, have these important conversations. So I appreciate your sort of candid response there.
Well, and your sharing reminds me of the importance that I've learned when we go out and we talk about suicide, whether it's in this setting or whether it's at a conference. It's really important to understand that if there's people sitting in that room listening to this, there's a good chance there's a reason why they're listening to this, because this is not a topic most people run to. This is a topic most people want to stay away from, as I reflected in my own life and demonstrated. So if they're there, there's probably a reason. And it's important to say along the way, hey, this could hit a nerve. This could be hard. Take breaks, take space. And that's how you continue to engage and move forward in this important work, trying to minimize getting overwhelmed by it as we all do.
Yeah. And I think this is a really great opportunity to talk about caregivers, families, people who are, there with veterans who are struggling.
Yep.
Even this year earlier, the VA changed its mission statement to include caregivers and families. So it's definitely been something on the agency's mind and agenda. How do you ensure your prevention and recovery programs are also inclusive and meet the needs of those caregivers who may be struggling or the family members who may need that support?
Yeah. First thing we do is we try to remain very humble about what we know, what we don't know, who we speak for, who we don't speak for. And part of that humility, part of that approach is saying, wait a second, don't put together all these resources for people from Washington, D.C., if you're not talking to the actual people that these resources are designed for. So we've worked from a caregiver perspective, we've worked very closely with the caregivers program office to understand what are they hearing is needed, what resources can be helpful here, taking a look at the questions and the issues they come across in working with caregivers and caregiver programs across the nation, and then really designing toolkits and resources around and built upon that. So I think a big part of it is start humble, stay humble, and listen to feedback about what people need who are facing these things head on. One thing that I learned in that is a case in point, a big risk period for caregivers is not actually directly when they're in that mix of the caregiving. It can be after the caregiving stops.
Mm.
For example, then the role is no longer needed, and you're balancing that with other forms of grief perhaps, or separation. And that's when the caregiver services may actually go away because they're not in that role, but then they're also in the very challenging role of saying, where do I go now? What do I do now? This was a big part of my life. So making sure that we view things developmentally, not just in these very strict categories and time periods, but humans, souls, lives beyond these really strict categories and times as well.
That's true. At the end of the day, we're all people, you know? We still face the same kind of struggles. Suicide, as they say, comes across all people of all walks of life. You know, the VA has its resources, but also getting down to that community level is so important to provide resources. Entities like veteran service organizations, private healthcare providers, support groups, these are all really key partners in sharing your mission. So, how is the VA working with these organizations to realize a better network and future for veterans when it comes to suicide prevention?
We are very clear that the VA has a responsibility, the VA has accountability. I have both in my role, but we can't do what needs to be done for veterans without the community and without partnerships. We developed a partnerships team that is dedicated 100% in their job every day of the year to developing and building and nurturing these partnerships with communities, with organizations. We started the Fox grants with the help of Congress, $80 million going out to local agencies and entities serving veterans. We have over 1,500 community coalitions that we're supporting and helping to build in communities, but also letting them run themselves with support from us.
Yeah. As we wrap up here today, I want to talk to the veteran. If there's a veteran out there listening who is struggling with SUD, mental health, suicidal ideation, what's your message to them to help them seek the treatment they need, seek the support they need, and ultimately to give them hope?
There's a lot of questions that go through our minds as veterans when we think about reaching out and taking those steps. I would say that the questions are understandable, reasonable, and really hard to answer completely in the moment. But if we could all focus on just taking one step, what's one step that you're willing to take now, and then go from there? I think that that type of Neil Armstrong type mentality is what's needed to move things forward. If you think about all the steps that are required and all the questions, it's overwhelming. If you think about the next step and then the next step and do it sequentially, I think then it becomes much more doable and you start to see the benefits of that in your life in terms of improvement in wellness, happiness.
Definitely. Dr. Miller, I've appreciated your wisdom today, the stories you've told, and ultimately sharing these wonderful resources with our listeners. va.gov/reach. We'll be keeping an eye out throughout this month for Suicide Prevention Awareness Month, and hopefully, some of the wisdom you shared today will reach through and make a difference.
Thanks, Melissa. I really appreciate it. This has been a great opportunity, and I'm grateful.
Thank you again to Dr. Miller and all of those at the VA working to help our veterans, caregivers, and families. I know that today's topic was heavy, so please, if you or someone you know are in crisis, dial 988 to access the Suicide and Crisis Lifeline. If you're a veteran, you can also dial the same number and press 1 to access the Veterans Crisis Line. You can also text 838-255. Also, don't forget to check out va.gov/reach to keep up to date with the latest resources and information about the VA's work around suicide prevention. We'll link to all of these in the show notes. Thank you for joining us on Empathy Affect. As always, please subscribe, follow, and share the show with your friends. Stay safe and healthy, and take a moment this month to show some love and support for someone around you, a friend, a family member, or a colleague. I'm sure it'll mean a lot to them. Until then, I hope you'll join us next time.
Empathy Effect is a product of Forrest Marsh. You can reach us at forrestmarshmedia@forrestmarsh.com with any feedback, questions, or inquiries.